Welcome to Fountain of Life Fitness. This is the first of a series of training sessions to help build bone density, repair broken down tissues, our old injuries we'd like to rehabilitate and also prevent future injuries, and to prevent the loss of our muscle tone. And we're going to start with doing a bit of massage ball work. There are some systems that are consistent with all of us. You know, sitting, working on computers, our shoulders roll forward, heads go forward. So we'll do a number of movements, particularly to address those concerns. So if you could get a massage ball, if you have, or something like a tennis ball like that, and sorry for this. Yeah, and the best way to do this, if you have, see there's a door frame here, we want to massage out the muscles, the pec tendons that attach to your collarbone, and then out down here by the armpit that attach to your arm. So you face into the wall if you have to, or if you have a door frame, and you turn your head away from the ball. So you're massaging out the attachments of the tendons of the pectoral muscles that are attaching to your collarbone and in the subclavius muscle between your collarbone and first rib and around by the chest bone, and then more down by the underarm. So like right here, if you bring your arm out to the side, this will help prevent the shoulders from getting pulled forward. For the neck comfort, you have your head turned away from the ball slightly down. Okay, so now we'll do the other side. So here my arm's out to the side, heads off to the other side. Get the idea. Palm of your hand should be facing forward toward the wall direction. Make sure you don't internally rotate like that. So you want to externally rotate your shoulder. And you know, sometimes you'll feel a lot of tightness here by the armpit. And again, that pulls on the humerus, your arm bone. So we're just going to help alleviate that issue. All right, so then the bottoms of the feet. I think this is obvious, and this is quite commonly done to help repair the plantar fascia. Mostly we just want to get better blood flow into the tissues and stimulate the proprioceptors in the bottoms of our feet. So that's like the nerve endings that help your feet sense what you're standing on. The other foot, so we have 3 arches in the feet we need to pay attention to. There's the big one in the middle we all think about on the outside of your foot, between the heel and the baby toe, that there should be an arch there. And then in between the second and third toe, in the forefoot, there should be another arch. And in babies' feet, if you see infants squishing their toes together, you'll really see that arch engage beautifully. Okay, we're going to now do a series of exercises lying down. These are corrective exercises to correct muscular imbalances. And you'll need a few different things here. A broomstick, or if you have a very light weighted bar, the massage ball that we were just using, a strap that's just not stretchy, like it should be firm, like this is a karate belt or a bathrobe belt, and also a small weight, or if you have a Pilates ball, it should be light for glute activation exercises. So I'm going to move the camera here, and if you are not able to lie on the floor, you can do this also just lying down in bed, but you'll need all these different implements. These are corrective exercises. I'm a corrective exercise specialist. The course I took was with International Sports Sciences Association, and Chad Waterbury is the teacher of the course. So this is based on his exercises from that program, along with repair tissue repair research by Heath, B.A.R. And definitely I would look into that. It's excellent research. Okay, so we're starting with a massage ball. We're just going to put it right behind your head, in your skull, not in the back of the neck. And the chin should be in pulled down position. So in this angle, it lengthens the back of your neck. And some of you, if your necks are very tight at the back, you'll feel immediately a bit of a stretch there. You'll notice that tightness. Ideally, it should just feel very comfortable. We're essentially doing traction for your spine. So as you relax here, shoulders are back. We're decompressing your neck, decompressing your spine. You'll feel that all the way down, even to your tailbone. So we want to lengthen the spine to help prevent degeneration of the discs. So very comfortably relaxing. Okay, so next action, we want to help our jaw. A lot of people have TMJ issues from grinding teeth. So if you bring your fingers on either side of your jaw and just open and close your mouth once or twice, you'll feel the joint moving. And now we're going to help even out the jaw structure. If you open your mouth all the way and pull your fingers slightly forward and push the fingers up into the joint. And it can be somewhat painful, so of course just manage the discomfort here. We're evening out the tension of the pterygoid muscle so your upper and lower jaw track more correctly. And hold that tension. Keep the chin in the down position. Close the jaw halfway and keep the pressure with the fingers into the joint. And close all the way, maintaining that pressure. And relax for a moment. And then again, just open and close your jaw. And as you note with your hands, you can feel that the jaw will be tracking more evenly. Sometimes there's popping, and the popping can clear up. Okay, next we're going to just do a nodding action. So again, you're relaxing here and nod the head up and down. So we're helping the skull to move more freely on the top of the spine to prevent the degeneration, particularly C1 and C2. Then relax with your eyes looking down through your body and take a deep diaphragmatic breath. So belly will lift, but also if you could think of breathing into your waist, expand to the sides, breathing into your lower back. The nodding action with your head. And now deep breath. And again, nodding. And breath. Okay, one more critical area we're going to work on here for the neck. So if you still keep the ball in the same place and keep the chin pulled down toward the throat, this time not moving the head, only moving the eyes up and down. So only the eyes up and down at your pace. And keep the eyes looking down and breath. If you can keep your jaw like this, lips together, teeth apart, tongue at the roof of the mouth, that will help take the tension out of the neck. Okay, eye action, eyes up and down, keeping the jaw in the set position. And breath. And again, eyes. And breath. Now we're going to just work on one particular muscle for the legs. It's the tensor fascia lata, the TFL it's called. It's right here. There's a crease at the top of, here's the leg and the pelvis. There's a crease at that joint. So if you can put the ball like that and turn toward the front. So if you have the top leg, I like to have the top leg forward and lean forward a little. This can be quite excruciating. I apologize. Just like move back a little bit if it hurts too much. This is a small muscle here, hip external rotator, externally rotates your femur leg bone and moves your leg out to the side away from your body. And this muscle often gets really strained when we sit a lot from the compression, and that causes the tightness down in the IT band. So we want to take the pressure off of that TFL, and that will help our gluteal muscles, the buttock muscles, work more efficiently. Okay, the other side. So it's on the kind of the front of the hip, right at the top of the leg, right where your leg attaches into your pelvis. Quite often, the right side for people is very sensitive. Not always, sometimes, of course, the left, but I would say most commonly people note the right one is tight. And I think, you know, when we're sitting for a long time, often if the mouse is in your right hand, you lean toward the right side. So this muscle gets really cramped up. And that leads to a lot of other injurious situations. Okay, that was great. So we're putting the ball away. We're finished with that. Okay, so now we're going to go through a series of exercises with isometric holds. Generally speaking, the hold positions are 10 seconds, and only the hamstrings will do 30 seconds. If you're new to this series, just be patient with yourself. After you go through it a few times, it'll become quite familiar and you'll be able to follow more easily. This is to help align your body and put yourself in order, just like you align the car wheels when you change your tires. Okay, so first just lie down, relax for a moment. Bend the right knee. Arms by the sides, palms facing the floor. Think of elongating your neck so someone's pulling from the top of your head, straight back. So the chin is pulled toward the throat. Then slightly lift the head off the floor. Now, if you can't do that, if that's too uncomfortable, you can keep the head down. Should feel this in the front of the neck. If you're really tight at the back, you'll feel it at the back. We're strengthening muscles front of neck. And head back down. Right leg straight, left leg bend. Elongate the neck. Chin is toward the throat. If it works, lift the head and hold. Shoulders should stay relaxed here. Make sure they don't roll forward. Head down. Okay, next, strap. So this is the strap, and we're using this for hamstrings. It goes in the right foot. Okay, left leg ideally on the floor. If that hurts your back, you can have your left leg bent like that. Right leg straightened. Now here, the purpose is to help strengthen the tendons that are holding your leg together. You want those strong joints. So please do not pull your leg closer to your chest. Keep the knee, for this exercise, please keep the knee directly over the hip. And if you feel it pulling behind the knee joint, then bend the knee. You shouldn't feel stretching too much behind the knee. A little bit, but not like, if it's mostly behind the knee, your knee is overstretched from hyperextension, and you need to keep the leg bent a little bit to release more other muscles, not the behind the knee joint. Really important for the knee health. Switch legs. Okay, left leg, right leg on the floor. Left leg, and the knee is over the hip. And then work on straightening the leg. Okay, so the knee is directly over the hip. And then you just straighten the leg according to whatever range you have today. Some days it'll be tighter, some days not as. If you go for a long walk, then probably you'll be a bit more stiff. That's okay. And you're deliberately pulling with your hands and pushing with your foot. So you're not just stretching, but strengthening. And when you pull like that, you're pulling on the muscles and bones, helping the bones and muscles to strengthen. Okay, leg down. Put the strap down toward the left. Next, the broomstick. So you got the broomstick. Bring the right leg up, knee over hip. And the broomstick is in the back of the right hamstrings. Then bring the left knee up toward the broomstick so you're in the quads, the front of the left leg. And then we're holding, now pressing your right leg away from you, pulling the left leg toward you. Staying centered with your hips and shoulders. Okay, reverse the legs. So now it's in the hamstrings, the back of the left leg, the front of the right quads, and you're pressing your legs, Left leg push away, right leg pull toward you. And you're still breathing, breathing deeply. Broomstick down, take it to the left side. Okay, the small weight or Pilates ball. So this goes in between the knees. Arms by the sides, so both feet are on the floor. Toes are pointing forward. This is to activate the glutes, particularly from the outside of the hips, the gluteus medius. So if you think of from the outside of your hips, squeeze both sides in toward the midline. Right and left side glute muscles from the outside of the hips squeeze in toward the center. Hold, even tension, both legs. Make sure you keep the glutes engaging. You shouldn't feel it totally on the inside of the legs, should feel mostly outside of hips. Release the tension, put that weight down toward the left. Now we'll do a recovery position. Take the arms out like this in like a Y position, like your arms are palms face up. Depending on the angle of your arms, you might be more like a T or lower. You might go up more like a Y. It depends on your shoulders and again, where they are today. We're just reaching, getting better blood flow, releasing the nerves down the arms. Now we bring the arms up. So imagine you had a big stability ball. If you have one, you can use it and you put it right on your stomach. Wrap your arms around it, wrap your legs around it, and pull it into your stomach with your arms and legs. Just have the idea. So your abs are contracted, and rock over toward the left and hold here. And we're rocking to the right and hold. You'll note that each position we're holding for 10 seconds. Come back to the middle. Relax the arms and legs for a moment. So next we'll bring the arms straight up over the shoulders and then bend the elbows. So the palms, you're at a 90-degree angle at the elbow and your palms are facing each other. Then bring the legs up, knees over hips. Here in this angle, you'll immediately feel your abs are engaged. Right leg, straighten the right leg only 3 inches. Do not straighten very far. Further is not better. If you straighten the leg too far, you'll use too much of your leg. Here we want to feel abs. So we're doing an abdominal strengthening, a version of dead bug. Right leg, bring it back to start. Left leg, just straighten a few inches only and hold. Bring the leg back. Okay, feet down. So that was one cycle. We're going to go through that 3 more times. Arms by the sides, palms down. Right leg bend. Elongate the neck. Pull the chin toward the throat. Slightly lift head and hold. Keep the leg relaxed, the left leg. And head down. Right leg straighten. Left leg bend. Elongate from the top of the head. Keep the shoulders back. Slightly lift head. Here we're strengthening the muscles in the neck so that when you're at your computer or reading books, your head doesn't just fall forward. And head down and rest. Okay, strap. Right leg. So strap in on the right foot. So here the right leg, knee over hip. Straighten the leg. You're pulling with your hands, pushing with the foot. And again, your knee might be quite bent. That's fine. Most importantly, do not overstretch the back of your knee. What you should feel, hamstrings up into the hip joint, calves, Achilles tendon, strong grip. In this, we're holding 30 seconds, shoulders are back to the floor. Rather than think of pulling with bicep muscles, think of pulling with shoulders back to the floor. And switch, left leg. Right leg is down, left leg is knee over hip. And just straighten according to your ability and pull. And as you're pulling with your hands, pushing with your foot. Okay, so the research Heath Barr is, again, the last name is B.A.A.R. It would be worthwhile to watch one of his interviews. He describes the research that they've done that indicates to rebuild tendons and ligaments that have been damaged over your lifetime. The best way to do that is 30-second hold and 2-minute recovery time. So here we're doing 30-second and then recover. And as we move through the series, through the other exercises with the 10 seconds, you get similar benefit. And for each exercise, you have a 2-minute recovery time. Broomstick, right leg is closer to you. Left leg on the other side, and you're pressing right leg away, left leg toward. Your arms should be straight. Hips are centered, shoulders are centered, and keep the pressure. We're not just passively stretching, reverse the legs. Left leg is closer, right leg further away. Left leg push away, right leg pulling toward the bar. Head should be on the floor, chin pulled down. So you see, you're not passively stretching, but we're creating resistance. You're creating pressure on your muscles and bones. Will make them stronger. Bar down. Small weight between knees. And at the same time, you're repairing tissues that have been broken, helping your broken down joints. Toes are pointing forward. Squeeze the glutes together from the sides and hold. Keep the shoulders relaxed to the floor. Just squeeze. This is activating the glutes. Hip lifts we'll do on other days. Today we're just working on the foundation, building a stable foundation. Take that away, off to the right. Okay, and then we'll bring the arms out in the Y position. Just reaching. This will help, the nerves down your arms for those arthritic hands we don't want to have. And the nerve pain, carpal tunnel, all these things, all the exercises that we do will really help you. Okay, then arms are up. Remember, stability ball on the stomach. Arms are wrapped, legs are wrapped, rocking to the side. And hold. And I really encourage you, give this class a try it a few times, and rock to the other side. And I can guarantee you'll feel a lot stronger just in your everyday life activities. It's really, really thrilling. You're helping to rebuild the tendons and muscles, the tissues that have been damaged in our lives. Okay, relax for a moment, arms out again. And we're here to get better and stronger. Arms are up directly over shoulders, bend the elbows, legs up, dead bug position, right leg straighten just a few inches so that you really feel the abs firing. And hold here. And a deep breath is always the best way. And right leg bring back, left leg slightly straighten and hold. And recover. Great. And then back to the start. Arms by the sides. Right leg bend. Elongate from top of head. Chin toward throat. Slightly lift head. Hold. Head down. Right leg straighten. Left leg bend. Elongate from top of head. Chin down and lift. Deep breath. Head down. Okay, and strap. For hamstrings, right leg. Knee over hip. And straighten and pull. So what you should notice here, this is our third time through, right? The third time, 30 seconds. And notice how much stronger your grip is and how when you're pulling, you can like really pull on your foot and your leg feels strong, your shoulders feel strong. Okay, left leg. The process that knee over hip and straighten, this tissue repair process is called shielding. That when you fell out of a tree and then you kind of hurt your leg, but you just keep going because you're strong. That's true. But that chronic damage, what happens is the tissues that are healthy will shield the injured tissues. And so the injured tissues for years and years stay broken. And you just keep using the ones that weren't broken down. And of course, that leads to chronic dysfunction. Okay, down. And broomstick. Right leg's closer, arms are straight. And when we do this system of these holding positions with force, it's helping the healthier tissues will fatigue, switch the legs, so that those tissues that have been damaged for a long time have an opportunity to rebuild and repair and get nutrients. The interviews with Heath describe that more thoroughly, that process. But just to give you, that's why we're doing this kind of hold position and not just moving around a lot. Bar down and weight between the legs, in between the knees. Make sure the toes are angled forward, toes are on the floor, arches up, glutes engaged from the sides. And here again, you should notice as you're engaging the glutes, how you can really squeeze them. And you can feel them working more proficiently than they did when we first started out. Recover, weight down, arms out in the Y. And here just reaching from fingertips. And then arms up and legs up, the stability ball in the stomach, your abs are engaged and we're rocking to the left and we're just holding. This is our rotational core muscles to train and prevent ourselves from over twisting our spines and knees. Rock to the other side and hold. If you're having a difficult time with this, just your abs aren't, rotational abdominal muscles aren't strong enough yet, not to worry. We work on that all the time. Arms out again, legs down, just recover for a moment. Okay, and arms up, elbows bent, so we'll do the dead bug position. Okay, right leg straighten a few inches and take your deep diaphragmatic breath, not using the shoulders. Shoulders are relaxed, using your abs. Bring the leg back, other leg. And recover. So the recommendation with the studies they did was 4 times, 30 seconds hold, 2 minutes recovery. So this is our 4th time through. Neck first, bend the right knee, arms are by the sides, elongate the neck, and then head lift and hold. And just notice, actually you feel more relaxed at the same time as you're stronger. Head down, straighten right leg, bend left leg. Elongate from the top of the head, chin toward the throat, lift and hold. And head down. And now strap for hamstrings. Right foot, knee over hip. So the pain level here in general, if you have a chronic injury or an acute injury that you know, it might be more painful for some angles. And the recommendation is, in general, the pain level can be, you know, like burning, achy kind of pain, but not sharp like ice pick sharp. So if you feel ice pick, then that's too much. You're, you know, it's creating more damage. We don't want that. But if you feel that your muscles are burning, that's okay. They're strengthening. Switch to the other leg. For me, though, most important thing is not just strengthening. Left leg, knee over hip, and straighten is alignment. We want the joints to stay in proper alignment, so when we walk around, our knees don't twist, that our ankles can support our bodies, our shoulders can stay in their sockets, the arms stay in the shoulder sockets. Okay, strap down. And broomstick. Right leg is closer and pressing, elongating the spine always. And reverse your legs. People who are concerned about pelvic floor, I mean, always we integrate that concept. Bar down. Okay, and the weight between the knees. Arms by the sides, and just squeeze the glutes from the sides. Just really think of the outsides of the hips. The groin will work, I agree. The psoas, your adductors, will help out, but make sure the abductors, the outside of the hips, are engaged. Excellent, that was perfect. We'll put that weight down, and then Y position with the arms, opening up your chest. And here, notably, too, you should feel like you can reach further, that your arms feel more comfortable. They're not so tight down your arms. Okay, arms up, stability ball on the stomach, legs lifted, and rock left and hold here. If you're weak with your abs, then when you rock to the side, usually your back will arch, like hyperextends. So just brace your abs. Think, use abs, use your abs. As they get stronger, it'll be really easy to do. Rock back to center position. Then bring the arms out again, legs down, shake them out a bit. Okay, arms up, bend elbows, legs are lifted. Right leg straighten a few inches, hold. Leg back, left leg slightly straightened, hold. Good. And rest. Now just lie down and just shake your legs out a bit. Notice how your hips feel loose, even though you've really worked hard to strengthen. When the joints, when you're stronger, when your tendons are stronger, you move a lot better because your joints will hold together. It's really thrilling. Okay, so the next component of our training today is spinal care, spinal strengthening. A lot of people are familiar with the work of Stuart McGill. So we're incorporating the bird dog and the side bridge. And we're also going to use the strategy of this, what Keith Barr said about the 30-second holds for repair. If you cannot be on your hands and knees on the floor, you can do this standing at the wall. So you would just stand at the wall in a push-up position, lift one arm and one leg. So the bird dog is just, many people are familiar with it. It's like this, you're on hands and knees, and you lift one arm and one leg together. The most important factors here are you want your spine, sorry for this view, but your spine should be straight as you lift. Like, you shouldn't be like wobbling to the side or collapsing any of those the joint systems. So we're starting with the right arm and left leg lifting. The Stewart McGill studies, they say 8 seconds is the optimal amount of hold time. So we're going to do 3 reps, right arm, left leg lifting. That will be like our 30 seconds. So you're on your hands and knees or at the wall. Hands are under shoulders, shoulders down from the ears. Push into the floor or the wall so you feel strong across your upper back. Your elbows should be straight, whatever you can do. Okay, now brace your lower back. Just imagine, think of your lower back and think you're going to just brace that gently. And then right arm, left leg lift simultaneously. Right hand, rotate, externally rotate, hold. Left leg should be foot flexed. You should take a deep breath here. Then down, and then again, lift simultaneously and hold. Left leg is straight, glutes engaged. Lower back is braced. Right hand palm up, thumb out if that works. Both arms are straight, come down. One more time. And then down. So that's like a 30-second for that direction. Now we're going other side, left arm, right leg. Now I had a very serious injury 2.5 months ago, severely dislocated and fractured and smashed my left arm. And so I don't have full range of motion yet, but it's remarkably better, phenomenally, I would say. So now we're going left arm, right leg. I'm telling you that because when I lift my left arm, I don't have full range yet, but it's unbelievably better. And then down, then lift and hold. So the left arm, we're trying to externally rotate. That means thumb is pointing out toward the left and palm is facing the ceiling. But keep the elbow straight, then down, and again lift. And then down. Okay, so in accordance again to this, the Heath bar tendon repair training, you need 2 minutes recovery. So that's why we're going to now do the side bridge. And we're supposed to do this 4 times through, so we're going to try to do that. Left arm is down. If you're at the wall, you just stand like this with your arm on the wall. The left side forearm is against the wall, palm down. If you're on the floor, this is really important for the torsion of your elbow. The palm of your hand should be facing like toward the feet, not into the floor. Okay, that's really important. Okay, so everybody, elbow is under the shoulder or directly in line with the shoulder. We're going to keep the knees on the floor. Even if you're really strong, please try that for today. Feet are flexed. Press the forearm into the floor or wall and either just hold there or lift and hold. So I can't lift yet because of my left shoulder. So I'm doing the baby side bridge, pressing the forearm, strengthening the shoulder, and strengthening the obliques. The purpose of this exercise mostly is the oblique muscles. Those are the muscles on the side of your waist, between your hips and ribs. So that's what mostly left side focus on those muscles engaging. And here we're just staying with that 30-second hold to help repair, to maximize our strength gains. When we do our weightlifting in the other training sessions, we'll be doing lots of reps and all fun things. And you'll be able to do that because you're strong. Other side, when we rebuild like this, got a good foundation. Okay, right arm on the wall or floor, and then forearm press. If you're lifting on the floor, hip hinge, you hip hinge up like this. So think hips come forward and up, don't just lift up vertically. If you lift up just vertically, then you bypass your obliques. So make sure you do a good hip hinge to lift. But everybody, whether your hips are on the floor or off, keep the forearm pressing. Keep yourself pushed out of the shoulder. Don't sink down into that shoulder. And if you get tired, you just come down and do what I'm doing, the baby side bridge. Okay, and then recover. So that was great. So that was 1 time through. So next time, this is set number 2. We do again 30 seconds, so you've had 2 minutes recovery time for each position, but we're working for those 2 minutes of recovery. Okay, here we go. We're on hands and knees or standing at the wall. Right arm, left leg lift and hold. Keep the left arm really strong. Then down and lift. And down and lift. Doesn't that feel a lot stronger than the first time? Then down, see what I mean? It's really exciting. Other side, left arm, right leg lift. Hold. Down and lift. Make sure you're not letting that lower back arch out. Brace your lower back. Hips should be level. This is really important. Down and lift. Don't lift the right hip up. The hips should be square to the floor. Right foot flex, leg straight. Leg down. Okay, that was really good. Side bridge, left side. Your knees are bent. Make sure your head is in a good position. Don't let your head go forward. Press the forearm, and then if you can do it, hip hinge and lift and hold. And down. Other side. So you see, the first time I couldn't even lift, and just the second time, I could get up a little bit. Right arm. Press the forearm, double chin. So again, don't just lift the hips up vertically, not just up. Bring the hips forward, then they'll naturally come up, hip hinge and hold there, so you're a straight line. And not, you shouldn't be a curve. Often people end up curving, like the hips go up too high. So again, you should feel it in the oblique muscles, the right side of your waist. And yes, your right shoulder for sure. Hips back. That's why I like to do it knees on the floor, because when people lift the knees up, most of the people, you just start using your legs and everything else and just skip the obliques. So that's why I like to suggest just do it this simple way. I find it to be more beneficial. Okay, back to the bird dog. Hands and knees, or you're standing at the wall. In your push-up, hands are facing up, hands on the wall, directly in front of shoulders. And then we're going right arm, left leg lift. Now, it's not better to lift your left leg higher than your body. And then down. If you lift your leg too high, your back is going to arch. You do not want your back to arch. Higher is not better for this. We want to strengthen the muscles and then down. They're called the multifidi. They're small little muscles that stabilize one vertebrae to the next. And to activate those, you need to have this proper alignment angle. If you go too high, you'll just arch your back and squish your vertebrae. We don't want that today. Down, other side. Left arm, right leg. Hold. Down and lift. Down and lift. Make sure you keep the hips level. The right hip here tends to lift. Now, if you notice that you're one of those people where the pelvis kind of tips up on the right, that leads to left knee being weak and right knee, like usually the knees are also an issue because they twist. Okay, left forearm. So you're pressing the forearm into the wall or pressing into the, if you're on the floor particularly, push out yourself out of your shoulder. Don't sink into it. That's it. And then do your lift and hold. hips back. Good, and switch other side. Excellent. See, that felt a lot stronger that time, right? Okay, right side. Okay, push yourself out of the shoulder. Have your double chin, so that means the chin is pulled back and toward the throat. Hip hinge forward, or standing grip, just press the forearm, hold. Everybody think of the oblique muscles on the side. Then take a deep breath. Okay, hips back. Good. And then roll to the side. Hands and knees. One more time, we'll go through this. Okay, so hands and knees, shoulders down from the ears, push into the floor or wall. Right arm, left leg. Left foot is flexed. The toes are pointing down toward the floor and the hips are level. Down. Make sure you're not tipping the head up. So your eyes should be looking straight down toward the floor. Keep the left arm straight, down and lift. Don't bend the elbow. Keep the shoulder, left shoulder down from the ear. Down, that was really good. Other side, left arm, right leg. Hold. Keep that right arm really strong. Push yourself away from the floor. There you go. Arm down, excellent. Lift and hold. Right foot flex, leg straight. Down, don't bend your right leg, straighten it. That's the way. Okay, down. Okay, that was great. Left arm, side bridge. Okay, why we do this series here? Left arm hold. It's because we need to strengthen the muscles so that our spine doesn't collapse. If you don't have muscles holding your spine together, it just falls apart. Okay, ready? Hip hinge, left arm. Think about the oblique muscles on the side. If you can't hold for the full 30 seconds, that's okay. You just come out of it and then you'll keep getting better as we practice. Like I said today, the first set, couldn't even lift, forget it, not a chance. And the third one, I did really well. Okay, left arm, right arm now, last time. Hip hinge forward, hold. Hip hinge back. Okay, that was awesome. So now we're going to stand up. So let's get up on the side. So you're on your right elbow. Bring the left knee forward. Bring the left elbow forward and walk up onto hands and knees. That's really good. And then we'll just do the easy way. Lift the hips up, walk the feet forward, walk the hands back. So we've been doing a lot of work here lying down. When you get up, you might feel a bit dizzy, blood flow, blood pressure changes. So just take a moment. Next thing we're working on is feet strengthening. I can't possibly describe how serious this is. Just a couple days ago, a friend told me her friend, she likes to walk a lot. She's really good, strong, like athletic kind of person. But you know, her main activity is doing long walks, which is great. We all need to walk. I love walking. We need to keep walking. Oh my God, that's why we're doing this, to keep walking. So she's just walking and she broke a bone in her foot. Nothing happened. Didn't step on anything, just broke her bone in her foot. And that's why we need to do this, to strengthen the muscles that are pulling on your bones, so the muscles and the bones in your feet and ankles stay healthy. Okay, we're all going to do this together. We'll just do two sets, I think, through. You stand like this at the wall. So this is kind of like surfer stance, I call it. The edge of your foot is touching the wall. So I'm right here, my right foot, the edge of my right foot is touching the wall. The entire edge from heel to baby toe, and a bit of a surfer stance, you use a little bend. Okay, so this is great. So you feel that foot, right? You can feel the edge of your foot. A lot of people cannot feel that. In the outsides of your feet, that's where we have the most proprioceptors, on the outer parts of our feet. And when those proprioceptors stop firing, you can't feel that, and then your ankles pronate, your knees go in, your back arches, heads go forward, all kind of things fall apart. Other side. So we should do this 30 seconds on each side, 4 times through the cycle, but we're just going to do this, I think, once. So we're pressing the left foot, and we'll go through it twice. The edge of your left foot, you're pressing. And you've got, your knees are a little bent. Make sure you don't let your back arch. And just focus on feeling the connection, left foot into the wall, into the corner, the entire edge. Not just part of your foot, that entire edge. And not just on and off, but consistent pressure for that full 30 seconds. You want to re-stimulate the proprioceptors. Shouldn't feel too hard. If you can apply more force, that's good. Okay, now we're doing the same thing, but feet are closer like this. Just hip width. Okay, and now we're pressing that foot, the edge of the foot, and hold. Definitely, you'll feel this up into your hip, right? You're getting the line, the kinetic chain, the nerves from your feet. They're sensing the wall, telling your hip what it needs to do, telling your body how it should be standing to apply force. And then turn around, left foot. Okay, so feel that entire edge from the baby toe right to the heel. And hold. And just stay focused on that edge of your foot. Keep your awareness there, creating your connection from your nerves, brain to your foot. So throughout the day, you'll have good balance. And you'll notice it once we stop doing this exercise, it's quite evident. Okay, now turn around. We're doing it again on both sides. The first time, if you want to, you do this. So your legs are a little wider, and you can roll the ankle. You see, you like lift your arch up. So you lengthen the outside of the ankle, like many of us have sprained our ankles when we played soccer and we're running in the fields. So the outside of your right foot, you can roll the ankle a bit. Keep the big toe on the floor though, and press into the wall. So it's just the outer edge, the side of your foot. Some people, if your ankles are very loose, you'll like get your whole ankle bone. That shouldn't happen. It's just the outer edge of your foot. And then lengthen the outside of your ankle and create force to rebuild those tissues, to strengthen the tendons and the ligaments holding the joints together. Then we'll turn around. Okay, big toes on the floor, arches up and press. Keep the big toe down and strengthen the arch. So the people who have too loose ankles, your ankles wobble, then your knees wobble, then the hips wobble, then your back wobbles, and then the neck wobbles. So we're just wobble. And this is really quite noticeable when your ankles are stronger, that you're much more stable. Okay, then we'll turn around. And this time feet are closer together. And this time you do not roll the ankle. Your feet are just flat, but the big toes down and arch up. Always we're thinking of lifting the arches. Make sure knees are a little bent. Don't lock the knees ever. A lot of knees are really hurt because of hyperextension of knees. That means when the knees over straighten. Okay, now we'll turn around and the other foot. And then we're quickly going to go through one more exercise for the feet. And this strengthens the nerves from hands to feet and also helps strengthen your Achilles tendon, the tendons at the back of your heel and ankle. Okay, so the next exercise we need is on the floor. Or you can sit down on your bed or even your couch or table or something, but you do need to sit down. And you will need again the strap that we used earlier when we did our hamstring exercise. So when we get damaged tissues, right, if you broke your arm or you sprained an ankle or sprained your Achilles or twisted your shoulder, there are a lot of shoulder, oh my God, so many people have shoulder problems like mine. And it's not just we think of the muscles, but the tendons and the joints, and also the nerves. The nerves become also damaged. Sorry that my head's cut off here, but the ankle is like this. So you take the strap, we're going to do, this is my right foot, under the right foot, so like in the arch, and your hands are even on the band, and sit up really tall and lift the leg. 30 seconds we're holding. Your foot here is perpendicular to the floor. Don't pull your toes toward you. That will be the second set. Make sure you're sitting really tall. Don't pull the shoulder blades together. Rather, you want to widen the shoulder blades and straighten the arms. So you're lengthening the chain, that line from your hands through the upper back. That's perfect. That's exactly the idea. You want to widen to strengthen the muscles holding your shoulder blades to the spine. Okay, switch legs. So left foot and the arch. And we're just going to lift and hold. Make sure your ankle's not twisted. Make sure the knee is pointing straight up to the sky. And when you sit tall like this, you can notice how it's that tension across your spine will strengthen the alignment of the vertebrae. You should feel your shoulders are strengthening, your grip, your hands are getting stronger, which is important for longevity. Okay, then switch. This time, the right foot, you flex it. That means you can pull your toes more toward you. So first bend your ankle, whatever you can get. Bend your ankle, toes pulled toward you, and then lift. There you go, like that's good. So there have been many, many studies that have shown, demonstrated that stronger grip indicates more years of life. It's an indicator of longevity. And of course, it's according to you, your size and your weight. Keep sitting tall, don't let yourself slouch. Chest open, shoulders shouldn't roll toward each other. That was really good. Then left side, so you'll notice how your abs are working. This is not just a simple stretch again, that you're strengthening. And with your bones, when you're pulling like this on your body, the bones are getting stronger too. You're building up your bone density. So thank you very much for coming. And we'll be recording more training sessions, the same kind of protocols, building up bone density, making our muscles stronger, helping to rehab and prevent our injuries over our lifetimes, making us more capable for our lives. And have a good day. Enjoy your walk. And if you have any questions, please do send me an email. Thank you very much.